It's great to be here to be able to, first of all, thank everyone in Vancouver for the support that you've provided for those of us working within the public healthcare sector to continue to respond to the COVID outbreak, to provide necessary healthcare services to people who need them. And I'd also like to thank others who are providing essential services in our community that are absolutely necessary as we continue to respond to this crisis over the days and weeks ahead. Now that COVID-19 is circulating in our communities, and I want to be clear about that, it is circulating, we need to remind people of the most important thing that they can do to keep themselves healthy and safe. And I'd like to thank Sandra Singh for reminding us that hand washing is the single most effective way that you can keep yourself safe. And that's because this virus is transmitted primarily by contact with contaminated environmental surfaces. It's not an airborne virus. If you're standing close to someone who coughs or sneezes in your face, that can be an issue. But the primary way it's transmitted is through contaminated environmental surfaces. And the best way for you to avoid being infected is to wash your hands frequently and avoid touching your face where you might inadvertently introduce the virus into your mucous membranes. Now that we know the virus is being transmitted in our communities, we are now turning as public health officials to consider how we can protect those populations that are most vulnerable to severe disease. And that includes our frail elderly population, particularly residents of long-term care facilities. And I'm sure you're aware, the deaths we have seen to date within Vancouver Coastal Health have all been residents of long-term care facilities. So we are taking a number of steps to avoid introduction of the virus into those facilities and to help reduce spread if we do see either residents or staff who are infected. But another group of vulnerable people that we're quite concerned about are the homeless, marginalized communities within places like the downtown east side who may have underlying chronic health conditions that could put them at higher risk for severe disease. So it's very important that we take steps to both protect those residents from outbreaks of COVID-19 and to ensure that if there are members of those communities who do become infected, that they receive the care that they deserve, just as others are receiving within our community. So I just want to emphasize that it isn't a matter of when COVID-19 will affect this population, it's how we act to minimize the risk that these people face. The opening of the shelters at Cole Harbour and the Roundhouse is part of this response. This is a crucial step to help prevent the further spread of COVID-19 among an already vulnerable community that has a high proportion of people who could be at risk. We are aware that crowding in shelters could be a way that COVID-19 could be transmitted, and we'd like to try and minimize transmission within those within the community. So opening up further shelter space can help us do that. And I would like to also say that this work has been a collaboration between Vancouver Coastal Health, City of Vancouver, BC Housing, and many other nonprofit providers in the downtown core. In terms of how we will use these new shelter sites, referrals will be managed by Vancouver Coastal Health's housing team. People who are homeless or sheltered people who need to leave their current shelter due to lack of space, for example, will be eligible to go into these new sites. We are planning that there may be people who are positive for COVID-19 or suspected to have COVID-19 within these sites, and there will be guidance on to how to safely, for example, cohort those residents so that they pose less of a risk to others within that shelter space. And we'll determine on a case-by-case basis where the safest place might be for someone to recover from COVID-19 if that person does not require hospital care and can safely recover within the community. We have protocols in place to identify and treat clients who show symptoms of COVID-19. We're actually doing surveillance now within the downtown east side on a proactive basis to be sure that we identify any outbreaks or clusters of cases. We haven't identified any to date. That's similar to the type of surveillance we have in long-term care, so that's already underway. We've also got protocols to meet the health and safety needs of clients who may develop COVID-19. For example, we do ask people who are infected to self-isolate at home. That can be a challenge in people who are in shelters or may not have adequate housing, but it can also be a challenge for people who may be suffering from addictions, who may have cravings and go into withdrawal. And we want to be sure that our physicians and care providers who are already providing care to those with substance use disorder in the downtown east side have the clinical protocols necessary to make sure they can support clients who need to, for example, self-isolate during their recovery. All staff who will be working in the new shelter sites and the volunteers will be given the resources they need to safely care for clients, and they'll be provided training so that they can understand how they can protect themselves, but more importantly, prevent introduction of COVID-19 into vulnerable populations, and they'll be provided with the equipment they need as well. Vancouver Coastal Health will provide clinical support for staff, volunteers, and clients through the services of our nurses, physicians, infection prevention and control experts, mental health teams, addiction specialists, social workers, and of course, all driven by the advice of my public health team. I'd like to thank the City of Vancouver, BC Housing, and all the nonprofits who are working with us, not only to address the response to COVID-19 in the downtown east side, but also for continuing to provide the services that that population needs. And I'd like to end by reiterating what the Mayor has said. We have 2 public health emergencies in our province at the moment, COVID-19 and the opioid overdose crisis. And for those living in the downtown east side, the most serious emergency remains the opioid overdose crisis. There are still people dying of overdoses in the downtown east side, so we must continue, for example, to operate overdose prevention sites, supervised consumption sites, and provide access to opioid agonist therapy and other services so critically needed for people with substance use disorder in that community, as we at the same time reduce any harms associated with spread of COVID-19.